Hi, I'm Dr. Teresa Wagner. I'm currently serving as the Interim Director of SaferCare Texas, the State Patient Safety Institute. And my role here is also Clinical Executive for Health Literacy. So I oversee the general operations of every day for SaferCare Texas, but I also advocate and teach health literacy concepts to help people better understand health information. Everyone should learn about patient safety because it is not only the responsibility of individuals to understand health information, but also what we know now is that it should be the healthcare system. So historically, health literacy has been defined in a term that made it the responsibility of only the patient. But with the new Healthy People 2030 guidelines, which many of us across the country who are health literacy experts advocated for, they have divided it out into personal health literacy and organizational health literacy, giving a nod to the fact that people shouldn't have to understand health information on their own, that it should be partly the responsibility of the healthcare system and healthcare providers to provide information in a way that people can understand. So when we talk about health literacy being, or health information being in a way that people can understand, one thing we have to realize is that in this double-sided responsibility between healthcare providers and people, that healthcare providers need to learn to speak and provide information in a more health literate manner, but at the same time, people need to ask questions. So one of the tools that we use in health literacy is called Ask Me 3, and that's when you go to your healthcare provider, you should never leave their office without knowing what your main problem is, what you need to do about it, and why you need to do that. Now, it's important for people to have good health literacy to understand opioids, because what we know is that a large percentage of people who become addicted to opioids actually have misused their prescriptions. And we also know from the literature that when we are delivering opioid information that it's not understandable, which is true for much of health information, but specifically in one study, health information about opioids that was written was not understandable by people. So when they took it home, they were more likely to not take their prescriptions adequately or appropriately. So maybe taking too much at once, taking more of the prescription before you were supposed to that day. So just different ways that opioids can be misused, and what ends up potentially happening is addiction. And so when that happens, people then need more and can become so addicted that it results in death. So it's very important that when we prescribe opioids, that we be sure that we have explained it in a way that people can understand and actionable, so that they can follow the instructions when they go home. In fact, in 2020, an average of 44 people died each day from overdoses involving prescription opioids. In Texas, 25% of people prescribed opioids misused them due to a lack of understanding. 39% of opioid overdose deaths occurred from prescription opioids in 2021. And at the same time, up to 80% of people who use heroin first misused prescription opioids. Health literacy is at the core of patient safety. When patients don't understand their care or health information that we send them home with, then they're at risk of having an adverse event. I found this particularly interesting in the study that I did that resulted in the What About Mom app, which is an app for postpartum moms. And how we conducted that study is we analyzed, using health literacy tools, the information that moms were sent home with after they had children. What we saw was that when testing them, that they weren't good when it came to readability, understandability, and usability, and in fact, they weren't culturally competent. So we send moms home, or other patients, with information that A, they can't understand or use, but B, that doesn't really meet the needs given their own particular situation. So when you find that, you really are putting these patients at risk. The other thing interesting about the What About Mom research is that the providers who did instruct the moms, rather than just sending them home with information, didn't touch on all of the same topics and often left out large issues that could be emergent and cause death, such as a warm, swollen calf, which would indicate a blood clot. So what the app does is it helps moms look up on the app what their issue might be, and it tells them what to do. Do you need to go to the hospital? Do you need to call your physician and make an appointment immediately? What action do you need to take that could save your own life? Narcan, or nasal naloxone, is an opioid antagonist for emergency treatment of known or suspected opioid overdose. People should learn about using Narcan because they can actually save a life. Just as a bystander, we know that when people are in an opioid overdose crisis, that they are going to potentially become unconscious. And so if you come upon a person who you suspect might be having an opioid overdose, you would then use the training that you had received to check that person, why are they unresponsive, and react accordingly. So using Narcan is a way that you can help to neutralize the opioids by administering the nasal spray, and then calling 911 and waiting with that person until the medical emergency personnel can show up on site and take over. Now, if they were to continue having an episode after a few minutes, then you would administer the second dose. Be sure you lay them on their left side so that if they come to consciousness and start vomiting, they don't aspirate. But it's very important that you take the training so that you know how to administer Narcan appropriately and save lives.